So I'm Dr. Diana Monteiro, and I'm a counseling psychologist, and I'm going to tell you a little bit about PCOS, or Polycystic Ovarian Syndrome, in teenagers. The reason we're going to talk about teenagers is because that's the age when it typically starts, and most parents and most teens don't realize these things because there's so many changes happening in the body during teenage times. So with all of the physical and mental changes that are occurring in the body, when you throw in this idea of PCOS, and understand it's called PCOS because it's not, though people say PCOD, I like to use PCOS because PCOS is Polycystic Ovarian Syndrome. It's a series of different things that happen, and it's not a disease you have. So understand that first to begin with, that this is not a disease. It's something that is completely treatable and manageable, and with certain things that you do in life, you can absolutely have a completely normal life. When I see young people who have been diagnosed with this syndrome, oftentimes I hear all sorts of crazy things like, oh, I've been told I'll never get pregnant, I'll always be fat, I'll always be ugly, which are totally not true. Yes, if you have PCOS, you can certainly have, things like facial hair start to come. You can have extra hair on your chin or on different parts of the body where hair typically is not, that prevalent. You can have, in fact, I was diagnosed with PCOS, but I only found out much later when I was an adult in my late 20s. And I had all the classic signs of PCOS by then. As a child, my neck skin would always be darker. And every time everyone would say, you need to wash your neck, you need to wash your neck. And I would spend hours scrubbing my neck and leave my neck red and raw, and the darkness would just never go away. Because that's just a sign of PCOS. What happens with polycystic ovaries is that in what's I don't know the medical background of it, but what I understand is you have your insulin in your body that your pancreas make doesn't work very well. And when it doesn't work very well, that causes certain problems. It makes you put on weight. And the other signs that it can be happening are that you have darker skin on your neck or your armpits or your inner thighs. You have these things called skin tags, which almost look like your skin is sticking out from, and I have several of them as well, unfortunately. And all of them are treatable. You just need to start getting regular exercise, you need to start eating healthy, and you maybe need to start getting on some medication to make your insulin work better. Now, the challenge is that women are told you have PCOS and they're told all the wrong information, and young girls hear all this information and get scared. Then they don't want to do anything about it. That automatically starts to affect their self-esteem. So what you're doing is basically taking a young girl, telling her she has PCOS and not telling her the right information, which ends up meaning, hey, I'm going to have low self-esteem, I'm going to feel bad about myself, and then I'm putting on weight, people are teasing me, and I don't know how to manage my weight, I don't know how to eat healthy, nobody's supporting me. So teenagers who have PCOS, parents especially, and teens who have PCOS, please firstly talk to each other about what's happening. Right? Communication is key at this time because there's so much misinformation being spread out there. Talk to a good doctor who gives you the right information. Going to a doctor who answers your questions, a doctor who's sitting and listening and actually tells you what to do and tells you why you should do what to do, not just writes a prescription and says, go do it. Talk to a doctor who understands that your teen, you are going through this. Now, what that's going to do is it's called being empowered. If you take your health into your own hands and go talk to a doctor, talk to your parent, tell your parent, I'm feeling not good about myself, let me get checked out. I'm worried, I heard my best friend has PCOS, I'm worried I have the symptoms too. That starts up a healthy conversation about whether it's really there or not. And if it is there, what do we do about it? What you do about it is actually not very hard at all. It's an extremely treatable condition. And for parents out there, the fear is always, my girl child will not have a child. That's not true at all. So women with PCOS have healthy pregnancies, have normal children, have a completely normal life. But please make sure you get the right information. So when you are talking to your teen, make sure your teen understands, and if you notice that your teen is experiencing low self-esteem, is experiencing depression, is experiencing anxiety, is putting on weight and doesn't know how to handle it, doesn't know how to handle the fact that her neck is dark, or she can't wear sleeveless because her armpits are darker than other kids, help her sort through those things, help her process those things. While it might not be possible to change it, it's very possible to teach a teen how to live with it and how to be very strong about it. So teach her how to handle it when comments come about, her weight or her hair or her acne or any of those things, when you empower your child, when you empower yourself, it's going to be greatly useful to you as a life skill forever. So I recommend strongly that you get help and get your PCOS treated, because it's completely treatable and you can live a completely normal life with it. Good luck.